and everybody else. Your class, your program is God sent. Everything pretty much you talked about, crash course, your questions mostly was all on the test.
Oh my God, really?
It was
So,
like, yeah, like pretty much everything. I did all of your questions, your question banks, plus your crash course assignments 1 through 6. And between all of that, it was on the test. And I want to say you're wonderful. I don't even know if I
uh,
would have did it without you. And thank you so much. It took exactly 30 days because I signed up September 2nd and it took it October
woo-hoo.
2nd.
Wow, that's a
And
good, because not
yes,
a lot of people do in 30 days. So
yes,
I actually get goosebump. I mean, I do because I think this is very serious, right?
yes,
We cannot afford to play around, and nobody's gonna push us to do it. So we have
yes,
to push it for ourselves. This is our time when nobody's just saying go test it. You
yes,
just do it. So yeah, so you did 600 questions from the crash course review. You did another at least 500 questions from the question bank. Then you did 175 times 3 tests, so
yes,
diagnostic tests. I mean, really, you have done over
yes.
150, 1,500 questions.
And what helped me was the rationales. I might have taken like longer than I had to do the test because I sat there and read every rationale. And I'm telling you, that test is very doable. It does require critical thinking, but your stuff, your content is there 100%.
Hey, this is very emotional to me. I really, I enjoy this. Like I work, I don't know, I work like 18 hours a day and I don't get tired because of
Yes,
those moments. To me, it's very serious, right? This is not something to make money. To me, is every single person that is in here deserve to pass. I cannot even imagine. I remember a doctor that did his course, passed everything, but he could not pass the board. Can you
Mm.
imagine the trauma? He did 6 times and he couldn't pass.
Oh, wow.
Yeah, I mean, some people just have a very difficult time, and I think the program does help a little bit.
Yes, a
So
lot.
good, good. I am so happy. So if you can, I put this in the link here to the chat box, our review. Just tell the world what we're here. We're here to help, and we actually love to help. So,
Yes, I'm going to post it on Facebook when I get back home.
all right. Hey, thank you so much for stopping by and
Thank
encouraging
you.
others. That's awesome. Thank you.
Yes, you're the bomb. Thank you.
Thank you. You
All
are.
right.
All
Take
right. Bye
care.
bye.
Bye bye.
It's good to see you. Good thing you didn't get a question, bone marrow.
Hi, quick
She was.
question.
Go ahead, Tamara. Hi.
Okay, hi. I'm trying to find out. So I'm logged in on two devices. How do I answer the questions? I just do it from either device.
Okay. You log in only in one device, and the other, you're going to
Oh,
get the QR code, the camera, right here, and you are going to pick a nickname.
oh, okay.
And you are in the game when you see your name here show up here. Now, when the questions come up, you are going to use your phone to answer the question.
Okay.
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 So if you feel stuck, let me know, Tamara.
Okay. Thank
Folks,
you.
yeah, my pleasure. Folks, there is a reason why we're doing this. Your brain needs to be in 1 minute. You got 1 minute and 20 seconds on the test. So those people that say, "Oh, I can't read fast," well, you don't have a choice. You gotta pick an answer. Okay. So that's the first thing. Second thing is Kahoot does not allow me to put a full answer. So grammar is gonna be very off. Might be missing conjunctions, but I'm trying to fit in at least something that would give you a sense for the answer. So just play along. If it's not written correctly, just understand it does not allow me to put more than few characters. Okay? And then we'll review the rationale together. All right? So it's a fun game. How do you know you are ready for the board? So if we have about 80 people playing today, I'll bet you right now $100 for each one of you, the top 10 that take your test and don't pass, I'll give you $100 because you will pass. I have no problem with that. If you are the top 10, depending how many people are playing, that means you are the top dog. You are. As simple as that. So let's see how many people are playing today. And you know, and it's normal to be the last. As you progress through the course, you gain more insight, and then you see yourself being the 5th, 4th, 3rd, 2nd, and 1st, and that it is how you know you're ready. Right? You're competing against your peers. Okay, let me see who's the first hand here. Nuria, hi.
Hi, good evening, Dr. Lopez. How are
Good
you?
evening. Good, and yourself?
Good. I just have some good news for you. I passed my boards today.
Whoop, 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 whoop. You know, I was actually, Nuria, what are you doing here? Because you should have tested already. So I was about to ask that. So that is awesome. I mean, how do you feel?
Relieved.
Yes, that is the best word.
Big sign of relief. It's guys, you are in the right place. I'm telling you. You do those diagnostic reviews, do them at least 2 times. If more, if you need to retain, but everything on in this whole course is on the boards. Trust me. You are not in the wrong place. You have landed on the right place, because when I got and I sat down after the first, I guess, the 25 questions it is, Dr. Lopez, that are those practice questions, those research questions. After that, it was just like ding, ding, ding. I was just hitting it. I was like, no way. No,
I'm telling you,
way.
folks, I have done it. I have done this over 3,000 times. 3,000. So when I beg you to study, when they say, please pay attention, I really mean it. There is nothing in the course that is the fluff. We don't know exactly what's going to be, but the blueprint is there. So all I have to do is look at the blueprint, and I kind of have a very good idea what could possibly be. Right? So we got to go a little bit broad just to give us safety margin.
Done,
but exactly that. So,
less than 2 hours.
Wow. Well, you know, guys, doesn't matter. I've done this 3,000 times and I still got goosebumps every single time. You know, this is fun. Passing the board is fun. So thank you, Nuria. I really, really appreciated you coming in. You know, lately I've been asking people, hey, give us a review in the Trust Pilot or Facebook, because they really help us. Your story is what connects with other people. I can be here all day long and say, guys, let's study. But when they hear from you, it's different.
Yeah,
you know, so thank you.
It was a pleasure being in your program. And I'm telling everybody, please do the diagnostic reviews, the tests, do all the modules, the crash course review, everything. Some of it was word for, Dr. Lopez, I'm completely stunned because of the way, how fast I was going through the test. I was just hitting it. And I was just looking around like, am I dreaming? But yeah, it was like that.
It feels like, doesn't it? Like I'm telling you, folks, as you walk into the to the Senate, kick that door open, because you are going to get your green check. Now, you have to do the work. There is no shortcut. You got to attend the live classes or do the classes on the recorded video. There is no free pass. We had 3 people in September that did not pass. That breaks my heart. But then when I go back and I look, did you do the question bank? I know all the data. When somebody says, will I pass? I'll tell you if you will or not, because I look at everything, right? So I'm not just saying, and you know me, if I don't think you are strong, I'll say, please reschedule. Right? But if I look at your scores, I look at your question bank, I say, close the book and go test. If you're doing well, you are the next one up.
Oh, I have a question. You said that you got the 25 question in the beginning.
No, she does not know that, and nobody knows that. I'm answering for Nuria, but that's a great question because it did sound like that. So
Well-
what I wanted to say is yesterday is exactly that. You will encounter questions that are weird. Do not worry about. Do your process of elimination. We don't know if it's good or bad question. Do your best and move on. If you are stuck on the previous question, where do you put the electrodes on a ECT? That is a hard question. If you miss that question, most people will miss questions like that, right? So don't worry about it. Go to the next question. Focus on the next question. If you are stuck on a question that you did not know the answer, it's most likely a bogus question. So move on.
Well, let me clarify, Dr. Lopez, like
Yeah,
what
please.
you said. So when I first got in, of course, it gives you the whole, like, tutorial on how to take the test, how to strike things out, things like that. So I did use that time to go ahead and do my dumping sheet. And they give you like a dry erase type of piece of paper to go ahead and do your dumping sheet. But when I first started, the first I want to say, I don't know, I'm just going from my experience. I don't know, everybody's experience might be different. The first 25 questions were just like, I don't know, I've never seen any questions like that in my life.
Yeah.
So instead of sitting there trying to figure them out, I just flagged them all. I just went down and flagged a whole bunch, like 25 of them. And after the 25, after that, it was smooth sailing from there.
Wow. So there is a very important lesson here, right? Don't panic. Don't panic. Flag your question and move on. And don't waste your time on a question that you do not know, because you could use that time to get something right. Right? So thank you, Nuria.
Exactly.
It's always a pleasure. Please count on us to, whenever you're getting stuck with the patient, you can always consult. You are part of the family, whether you are in the course or you have graduated. So thank you for being here today.
Thank you so much,
Okay.
Dr. Lopez, and everybody hang in there. You got this. You guys got
All
this.
right. Awesome. All right, folks, we are about to get started, but we have a very quick question. Jennifer, go ahead. Now let's limit the questions for Kahoot right now, okay? Because we gotta go. Jennifer, are you there?
Yes,
Okay.
I'm there. Sorry about that. Yes, I
Go ahead.
just started, so I'm still getting myself familiarized with the system. I just finished the module. I was looking for module 1 questions. I didn't see it. All I seen was it says question bank. But I know
Okay.
when I was doing it, it had some things that's not in module 1, like Alzheimer's and all
Okay.
that other stuff. But I did finish it with, I think it's for 78, I think.
Okay. So we'll go ahead and answer that at the end of the class, and then we'll do like a show of the course, and then we can get in details, okay?
Okay, awesome. Thank you.
But please remind me, okay?
Okay, thank you.
All right. Last person, Latoya.
Okay, so I'm just trying to determine if I'm actually in, because I see my name now.
Okay, good. Yeah, so I'm going to scroll. You guys can see your names. Hey, guys, if you are in the top 10, I hope you have done the whole course. But if not, you are very, very strong. We got a lot of people here today. So that means if you are scoring in the top 10, you are strong, really strong, okay? No fear. Okay, so Christopher, last question and we'll get started. Are you there?
Yeah, it's Christine again. Sorry, I'm on my
Christine?
son's thing. I'm sorry.
Yeah, no worries, Christine. I apologize. I cannot remember everybody's name.
I don't know if I'm in or not. What did I have to do to get to? I don't know how to work this game.
Okay, do you have a phone?
Yes.
So open the camera, and this is your QR code here. Use your phone,
Oh, okay. Open the
and then it's going to ask you for a nickname. And then you are going to see your nickname here.
Wait a minute.
So-
I'm on camera. I don't know what do I have to do? Put a hashtag?
No, you just put your camera
Yes.
next to the QR code, and it should open up a yellow link.
I don't see a QR code though.
Do you see see
I
my
see it
screen?
now. I got it.
Okay,
Sorry, everyone.
no worries. No worries. So everybody, and then you pick a nickname, whatever you want to be called for tonight. Everybody, you have 1 minute per question. 1 minute per question. That is it. There is a reason why, right? Is to get you out of being indecisive. Getting you out. Pick your answer. 1 minute. And then we'll review the answers. You play Kahoot on your phone. You got to put the answers on your phone. Okay? So let's get started. Everyone, I'm super excited. Let's get started
Dr. Lopez,
now.
it looks like there's another link. Like a lot of students are in that class. Even me, I was in that class prior.
I'm not.
Dr. Lopez, we're coming. We ran the wrong chat.
Okay, thank you. So I'm not sure, guys. It should be always the same link. So I'm not entirely sure how that happened. So do apologize. Give it a minute for everybody else to get here. In the meanwhile, we can answer a few questions. Go ahead, Mary.
I'm kind of discouraged because I spent all week, redoing, going over module 1 and module 2, module 1, module 2. And I took the test on module 2 and I did not do well. And I felt like a lot of the questions are going to come from module 3. There was a lot of therapy questions on
Yes, you are right. Okay, so do not base your entire fate on the questions on module 2. So some of that will be module 4. Remember how yesterday we talked about seabird and we said, hey, cage or dust, for example, or outed. Okay, so that is part of motivational therapy, but also motivational therapy is part of module 4, right? So there is a little bit of a mix. Do not sweat. Learn from your questions, and then you're good. Now you have the knowledge that you learn plus the rationale that you learn in the question. So it is normal, So just keep up, keep doing it. Very, very soon your test day is coming up.
Okay.
All right.
We are freaking out too.
Okay, 1 second. Vilma, hi.
Dr. Lopez.
Dr.
Hi.
Lopez,
1 second, guys. I gotta do the hand here. Vilma, please.
just a quick question. I was doing the cards and anterior cingulate cups is coming up. Do we really need to know that definition?
Yes.
Verbatim or yes.
Yes.
Okay.
Absolutely, you need to know.
Okay.
Absolutely, you need to know.
Thank
Good
you.
question. Absolutely. Victoria.
Yeah.
Hi.
Dr. Lopez.
Hi.
Hi. So which of the code I'm trying to put the pins, but the pin, is it all the pins?
Okay, so did you go to www.kahoot.it?
Yes, I did.
Are you looking at the screen right now? There is a pin code right here. I'm circling for you. 7397005.
Okay.
So after that, you gotta pick a nickname.
Okay. All right. Thank you.
Okay. All right, folks. This is it. We are about to get started. All right. I apologize for the inconvenience there. If you're still trying to get in, 1 second. Let me put the pin code here. And we are about to get started. Good luck, everyone. Let's do this. Use your phone to enter the question or your choice. Okay, so serotonin, depression, right? And very anxious person, right? Yesterday we said anxious, low GABA, and a lot of norepinephrine, right? So here on Kahoot, you get points from being right, but you also get points from being fast. So it's important. You see your answer, click it. Don't sleep on it. Okay, so let's take a look on the rationale. Yeah, serotonin and norepinephrine is the correct choice. Serotonin and norepinephrine is implicated in mood regulation, right? So we know that. Yesterday we talked about neurotransmitters. I know there is a lot of emails from yesterday. People ask me to recreate the chart. I will. Give me a little bit of time. This weekend you get all that answered to you. So email me if you do have a question. Okay. So next question. Seconds. Okay, guys. The question was like, is this side effect or is this severe toxicity, right? And the question had or said something about severe diarrhea. When we have severe of any kind, our eyes should get big and say, this is toxicity. There is no medication out there that will give you severe clapping headaches or severe urination or whatever. Doesn't matter, right? It is I can't say 100% for sure, but if you see severe, you should be a watch out for toxicity. Right? So here's the deal. Lithium has a narrow therapeutic window, which means 0.6 to 1.2. Now, pay attention. What if it's 1.3? Ask yourself, does the patient have side effects? If the answer yes, you stop the medication and you collect labs. What if it's 1.4 and no symptoms? You continue the medication and reassess. What if it gets to 1.5? Stop. With symptoms or without. Please know that 1.3, 1.4, it is the gray area, right? Books may not tell you this, but I'm telling you, ask yourself, does the patient have symptoms? If it's yes, stop the medication. All right, so this was sort of a repeat. How do you know this is not dopamine? right? If the question had all the things that it had, plus seeing things or auditory hallucination, then we gotta look at dopamine, right? So this is, again, serotonin and norepinephrine. Ask yourself, what is the condition that is describing in the scenario? And then it may help you to really find the better answer there, right? So bipolar. For the board, anytime you hear labile mood, you give a mood questionnaire. You will remember my voice. You give a mood questionnaire. What if it's a child? Give a mood questionnaire. Man, everybody's so fast. That's good. Wow, we got 75, 80 answers in less than 10 seconds. Oh my God. We got to make harder questions. Wow, we got 105 questions. I mean, participants today. I got to increase my account for Kahoot. I got to pay more. All right, good, guys. You got 20 seconds. Pick your answer. If you have a question, put it in the chat box, okay? 10 seconds left. One second. Yes. All right. Here's the deal, guys. Lithium comes with hand tremors. Those are fine hand tremors. Can you see fine hand tremors? No. The moment the patient is shaking, that is coarse hand tremor, and there's a critical assessment that you need to know that is equals to toxicity. Sure, in real life, not really. We're still going to stop the medication and then collect labs. If you ever find yourself collecting labs first, eating a hamburger, waiting for the labs to come back to make a decision, you are in the wrong. Okay? Stop the meds, collect meds, reassess. Real life, tests, it doesn't matter. The same thing. Right? Hand coarse hands, and tremors and confusion in one patient. That's too much, right? That's lithium toxicity. Okay? Ask yourself, why do you need to get a CBC? By the way, what labs do we learn to get for lithium, right? CBC is not one of them, right? Get a beat. I'm not going to say because that question is going to come up. So next question. All right, strong work, everyone.
Slow down.
10 seconds, and we got 111 answers. 5, 4, 3,
Guys, this
2,
is the
1.
wrong class. Everybody's in the other class. I keep hearing voices.
Not sure what you say. We're here, so I got to figure out what happened. Okay. This is the class for the Kahoot. Kahoot link is always the same. Now every week we change the class link, right? But Kahoot is always the same. Okay, here's the deal, guys. So it said the patient with a history of schizophrenia has been taking olanzapine for the past year. The patient report minimal physical activity.
I know I'm in the Kahoots game. Somebody's talking. I don't know who it is, why I have 2 sessions.
Man, please, I can't help you. I don't know why you have 2 sessions. So
Just log out of one.
Log out.
You're distracting other people.
okay, so here we are. All right, so if someone is on the antipsychotics and they are stable, do not destabilize your patient. Okay, so what do? You recommend lifestyle modification, which includes consult a dietitian, diet, exercise, go for a run, go for a walk, right? What if the answer is to educate the patient that stopping the medication is wrong, right? Let's say it beautifies the answer. Ask yourself, is that really answering the problem of the patient getting a little extra weight? It's not. So look for an answer that really solves the problem. So the education is on lifestyle modification. So anytime or anywhere, really, you have someone stable, do your best not to destabilize the patient. Try to maybe minimize the medication, or what you can do without disturbing the medication is lifestyle modification. Go to the gym, hit it hard, hit it every day, right? But get better. It says persistent diarrhea. So let's see the answer here real quick. Right? So signs of diarrhea, nausea, confusion, suggestive lithium-induced gastrointestinal side effects, right? It was a little hard because it sounded very good. Lithium-induced nephrotoxicity is more common associated with renal impairment and electrolyte balance. Ask yourself, how is diarrhea or nausea associated with kidney? It's not. It's gastrointestinal. Right?
Dr. Lopez, I do not have.
One second, man. We can stop now. All right, 4 seconds, 2 and 1. Okay, so the choice is mixing lithium with a small amount of water is fine to minimize the taste. Avoid taking lithium with water. Do we ever avoid taking lithium with water? No, right? And the better choice is take lithium with a full glass of water to ensure proper absorption. Now, someone had a question, was trying to speak during the event. If you do have
Yeah,
a, go
I
ahead.
just don't have the pin to the
Okay.
email. You did not indicate the pill, so I can the pin,
Okay.
so I
Okay.
cannot
Ma'am,
participate.
okay. Look at the chat box. I'm going to put the pin there for you, and then you can log in, okay? Look
Okay.
at the in the chat box. And let me get the game started here for everyone else. Give me a second. Or if someone that is in the game can put a pin code and where to go for her. So taking lithium with a full glass of water is advised to ensure proper absorption. Lithium, right? It's a high yield medication that we need to know that hydration is super important. So who are our population that we are worried? People playing soccer in the sun, building house, going camping. Take 2 liters of water with you would be a statement to say, hey, I understand how to take my lithium. So understand that we teach you about lithium hydration. On the tests, they will ask you, they're never going to ask you which of the following should you be worried about. It'll give you examples of lithium dehydration, and it's your job to connect the dots. Okay? All right. So ten seconds left. 3, 2, and 1. All right. So what do we know about lithium? Is neuroprotective medication of choice for bipolar disorder, right? So it protects the neurons, right? So what does it mean? If it's protecting, it's helping the cognition, not making worse, right? So neuroprotective effects and can protect and improve cognition functions while reducing cognitive decline in individuals with bipolar. Does it help schizophrenia? No, that would be clozaril would be the medication of choice for those with suicidality and suicidality for schizophrenia patient. Clozaril would be the best choice. Okay. All right. Okay, if the patient comes to you and says persistent nausea, hand tremors, and increased thirsty, if it's persistent, right, it is quite some time. So always stop the lithium, order a lithium level. And again, with Kahoot, it does not allow me to put a lot of characters. So I have to be very, very creative. So if you read something like, go for it, okay? It's just hard to put the right answers in very little space. So here you have priority action in the presence of symptoms that may indicate lithium toxicity, right? You will most likely stop the medication and collect labs. Simple, right? Now, if the person is in AD and having cardiac dysrhythmias, or lithium could cause a T inversion, right? At that point, you are not asking the patient to stop a lithium because that already has occurred. Okay, we'll go more in detail after this event. It's one of the questions for our diagnostic test. All right, we got 10 seconds. Pick your best answer. All right, we got 111 answers. And 15 now gone. Okay. Discontinue antidepressant and continue the mood stabilizer. What has caused the hypotensive crisis? Right? It was the mood stabilizer. Right? So you really want to discontinue both. Right now, the mood is not important. Right now, his life is important. Blood pressure is through the roof. Take everything that's not important. When do we get a patient in ICU? Do we really care about his Pepto-Bismol? No, we don't, right? We care about keeping him alive, put him on epinephrine, put him, on things that are going to keep the patient alive. Then later, we are concerned about the small stuff, right? When you see the diastolic pressure over 120, right? So do not administer benzos for hypotensive crisis. You need specific medication to decrease the blood pressure. C should say discontinue MAOIs. Okay, so sorry about the misspelling there. I okay, I get it. I get it why some people said administer antihypertensive medication to lower the blood pressure. Got it. It's true. But the first thing is what is causing the hypertensive crisis is MAOIs. So take that out. Take that out of the equation. And then obviously you're going to administer antihypertensive medication. Not a bad choice. Okay? But if you're still giving MAOIs, the problem is not going away. Right? So the priority is discontinue MAOIs immediately is the priority action in the presence of hypertensive crisis. It is very serious. Okay. All right. So perhaps that's an exception. If someone is stabilized, we try to never destabilize the patient, right? Unless if it's necessary. Well, first things we say, what can we do to still maintain the condition, the symptoms at bay without disturbing? But here is a safety issue. What kind of issues could lithium cause for the baby, specifically in the first trimester? And what other medications can we use in absence of lithium, right? So we definitely need to gradually taper off the lithium and explore alternatives, mood stabilizers, which would be lamictal, right? It's the most studied mood stabilizer during pregnancy, okay? So discontinue the current med as it is considered safe, or continue the current medication as it is considered safe. Not really. Okay. And B, Green said recommended non-pharmacological intervention for mood stabilization. It doesn't work very well. Okay. It could be an adjunct, but it will not take care of the mania or hypomania. Right? They need mood stabilizers or SGAs. So lamictal would be the medication of choice for pregnancy. Lamictal would also be a medication of choice for those that do not want to gain weight, right? There are people that want to gain weight. The majority of us says no, away from me, right? Wow, you guys are fast. 70 answers in 20 seconds. Okay, so from now on, for the rest of your life, when you see DEPA code, you say, right, hepatotoxicity and pancreatitis, right? So these are two FDA warnings signs that you need to know. Guess what? You will need to know what a hepatotoxicity looks like and what pancreatitis look like. Then think about the baby. If someone is pregnant taking Depakote, would that be dangerous? Right? Now think about what labs you would ask. Right? So if you got pancreatitis, what labs would you ask? I'm not going to answer because we are going to see this question in a minute. Right? So discontinue Depakote immediately and ordering a liver function test. What if somebody calls you and says, Dr. Lopez, tomorrow I have my appointment, but I just want to let you know that I'm having this upper right quadrant pain. Oh, wait a minute, that's where my liver is located. That is liver toxicity or hypertoxicity, right? Immediately go to the ER. Do not come to my office tomorrow. Go to the ER immediately. So you got to know those symptoms. They are serious, okay? And that actually cause death. So your actions should stop the medication, send them to the ER immediately, as soon as possible. Okay, so when we say Depakote, we remember liver toxicity and pancreatitis, right? So for liver toxicity, what labs will I get, right? AST, ALT, basically a liver panel. How about pancreatitis, right? Your pancreatic enzymes, right? That's what you want to get. And remember, the lithium can also, I mean, not lithium, my apologies. Depakote can also cause ammonia levels to be elevated. So always get your ammonia levels as well, okay? So severe abdominal pain, nausea, and vomiting are indicative of pancreatitis, right? Prompt discontinuation and order pancreatic enzymes test, okay? I don't remember if somebody said just discontinue the medication and assess, right? That would not do it. And we do not order CBC as part of the assessment. It doesn't belong there. Okay? Man, you guys are fast. Love it. 10 seconds and we got 50 answers. Okay. So if we talked about Depakote, now it's carbamazepine. When you see carbamazepine, you say 3 A's. One for agranulocytosis, second A for aplastic anemia, and the third A is for the Asian population that we have to be careful. Anytime someone is on carbamazepine or clozaril, they sneeze, you stop the medication. Okay, I'm being silly, but honestly, sore throat, mild fever, 100.5, you stop the medication, right? Because there could be a risk for infection, and clozaril and carbamazepine are high yield for agranulocytosis, so the correct action should stop. Pay attention on this, okay? Can be very settled, such as a sore throat. You stop the medication, okay? Malaise, not feeling good. Stop the medication, order labs, reassess. All right, everyone gotta get this one correct. Everyone, 100%. Maybe 100%. Let's see. Well, we got 105 answers in less than 30 seconds, so a lot of people are confident. All right, we got 20 seconds. Five, 4, 3, 2, and 1. I just mentioned in the previous, I trust that you try to do carbamazepine, but maybe slip the finger and you pick Lamictal, right? So when you see carbamazepine, you say 3 A's: agranulocytosis, aplastic anemia, Asian population. Okay, it could cause agranulocytosis now, right? So it could cause, I can see the question where Stevens-Johnson syndrome, you may pick Lamictal, but if the question says Stevens-Johnson syndrome in an Asian population, pick carbamazepine. If it's about Stevens-Johnson syndrome and Caucasian person, Hispanic, whatever, doesn't matter, then you pick Lamictal, okay? I really trust this was a messed up and you really got the content, okay? But if not, we'll clarify. It is always, we can always improve and get better. Doesn't matter where we are, okay? We all been there. So carbamazepine for the rest of your life, you remember 3 A's, okay? All right, got it. How do I know my kidneys are functioning correctly? All right, we got 10 seconds and 113 answers, so some people need to answer. All right, that's it then. Huh? All right, we got one more. Done. Okay. Lithium is kidneys, right? How do we know the kidney is working properly, is healthy? Look at your BUN and creatinine. It's going to tell you a little bit about the kidneys, right? You can look at your GFR, right? These are indications. But if you look into your ALT, AST, you're looking at the liver, and lithium is not excreted by the liver. Okay. Now I can see the thyroid being tricky, right? The TSH, but then again, I'm accessing for hypothyroidism, which is a side effect of lithium therapy. Now, about the CBC, I don't know what you're trying to assess that for lithium, but it's not your kidney. Okay. So all good. Sometimes it happens with our fingers in a phone gets stuck, but I really want to make sure that you guys understand the rationale. Okay? Lithium is primarily excreted by the kidneys. You can even tap the back of your back that to make sure that the kidneys, and you connect that to lithium. Okay, we cannot afford to miss easy questions. All right, next question. Here we go, motivational therapy. Hard question, huh? All right. Okay. All right. So if we're talking to someone and they get agitated about their substance use, alcohol consumption, listen to them, be non-judgmental, and explore their feelings, right? Saying to the patient, hey, listen, dude, you are never going to drink again and your license is suspended. It's not going to work. Confronting the patient, it is not how we do it for motivational therapy. Anytime you find yourself confronting someone and the question has motivation therapy, you say, no, this is not how it's done, right? Now, you can offer the patient rewards. Hey, maybe you can get $10 if you don't drink it today. Probably it's not going to work, right? They're not ready for this. And shifting the conversation to a different topic to avoid confrontation. Glad nobody picked that. Okay, let's talk about soccer. Doesn't work, right? So reflective listening and empathetic response. That alone is a nursing response. Nurses love to be reflective listening, empathetic response, understanding of the patient. If you see answers like that, good, right? That's what nurses brings to the table. The different side is not only about medicine, right? And we can argue a few things on this, but not today.
You're muted.
Yes, I was muted. I was yelling at my kid. He had walked the dog. Okay, so elicit and explore the patient's own beliefs and concerns about their medication, right? So provide the patient with educational materials on the benefit of the medication. It's helpful, right? But that is not exactly how you are going to convince this patient by saying this medication is very good. Well, rather than say, nah, explore what do you know about this medication? How does it make you feel? Or what are your concerns? Right? Addressing the problem would be more helpful than just educate. Essential to respect the patient's perspective and explore their own feelings and concerns, right? About the medication adherence. That is, in a nutshell, motivational therapy. Never force them to do something that they don't want to do. Can't educate, but an answer like that is a little bit better. That is not that education is incorrect. You are correct. But which answer is the best answer? Typical nursing question. All right, we got 5 seconds left. All right. Reflect on the patient's feelings and explore the reasons for the change, right? So these are expressed concerns about the patient's self-harm, urging them to seek help urgently. Not a bad answer, right? But again, if it's motivational therapy, we got to somewhat be very understanding and reflect on the patient's feeling as well. Okay. Remember, even patients that are on the inpatient, they can refuse medication unless if the court says no, right? Or yes. All right, let's take a look here on the rationale. Good job of Miami Branch MP. All right. So elicit the patient's concerns about the cost and the commitment and explore their values and priorities, right? So that is, in a nutshell, again, one more time, motivational therapy. So try to understand where they're coming from, in essence, right? So to acknowledge and explore the patient's barriers, concerns, rather than immediately offering a solution, right? Sometimes people just want to be listened, right? Just want to be heard. Okay. Okay, very good. I love that 102 of you guys picked the right answer. But let's talk about this question. During the session, the patient expressed their doubts about the efficacy of the medication and concerns about potential side effects. The core of the question is, how should the PMHNP apply feedback? Right? So which one of the four answers, it is a feedback to his concern? Acknowledge the patient's concerns and explore with previous, whatever previous medication they used and what are the concerns, right? So you got to look at frame. You got to understand motivational therapy and what frame stand for by the letter. Because if you kind of know, and they give you four choices with the A in it, it's going to be confusing. You gotta know cage, frame, and many other things that we cover in the course, okay? So feedback component of the frame model, providing feedback and should involve a non-judgmental, that is important, non-judgmental and empathetic approach, always. Okay, if you have a person that's a heavy drinker and their friends are hanging around and he's concerned, do you really think that he does not know what to do? He does. So what do? You rephrase it. What are your values and priorities? You're not going to tell them what's the answer. They know the answer. Just have them reframe. Instead of when people ask me a question, oftentimes I say, tell me what you know about that. And the person ends up answering their own question, right? So explore what is important to you about not drinking. What are your values? What is your connections with your friendships and your health? Which one is more important? Which one do you want to follow, right? Instead of telling them, hey, disconnect from those folks that are drinking is their priority, right? They know. So that is encouraging responsibility in a non-confrontational way, part of frame, right? So I promise you guys, people come to you, they already know the answer. They just want to be validated or provide a different way of looking at the problem. And that is what psychiatry is all about, is the marriage of hope and science, right? Okay, 1 second. See the feedback here. Provide clear and specific recommendation for gradual exposure, right? So that is the key, is gradual exposure. That is a device, the components of frame model that provides clear and specific recommendation for the patient's needs and preference in the context of exposure therapy, offering guidance on how to approach a gradual exposure exercise that can be helpful for the patient. Perhaps maybe looking from outside, looking at the group for a few days. Next time, come in, don't say anything, just sit down until they feel better, better, and better. So if you are getting those questions incorrect, it's okay. It's not a problem, right? In order to be better, all you have to do is try. Try and try again. And when you least expect it, the light comes on and you start getting all these questions right, one by one. It is the learning experiment, right? The more you do it, the better you get. Okay, very good, everyone. All right. Emphasize the importance of medication adherence regardless of side effect that is not therapeutic. Okay. So how do you offer empathy, right? Offer empathy by Another thing it says, empathy here, right? So validate the patient's concerns about weight gain and sedation because they are true concerns, right? Nobody wants to blow up like a balloon and feel tired all day long, right? It is true. So offer empathy and validate the concerns, right? So today I had a patient and he's really in trouble. This guy's in trouble. I'm not going to talk about his case, but it was difficult to get him back because he talked about his dog. He talks about his mother. He talks about his neighbor that in the ED, his mother that broke her foot. And this guy is in trouble. He's in a lot of trouble. I can't discuss his case, but he's in a lot of trouble. But every time I try to break the frame, right, his thoughts, because it's all over the place, and try to bring him to the present and focus on what he can do, right? but also offering empathy despite of what he may have done, right? So he feels validated. Hopefully tomorrow I don't get bad news. But as the patient left my office, it was challenging, right? But ultimately he want to feel validated for what he's going through, right? It is important. All right, 4 seconds. All right, let's say I know nothing about psychiatry, nothing, zero. But I know one thing. The question was about support. Which of the answers has support in it, right? Address the patient concerns about group therapy, great, and support their fears, right? What is the fears? So at minimum, sometimes you look at the question, look for sentiments or similar wording in the answer if you are ever stuck. That is a strategy. We do not rely on strategy, we rely on knowledge. But at times, we may feel stuck, and if we don't know what frame stands for, and if we don't know how to apply support, look at the answer. It says support on it, okay? So we can learn from those events, right? Explore the patient's concerns about group therapy and offer support in addressing their fears, right? Support is a component of a frame involve providing support tailored to the patient's needs and preference. Great. I hope everyone gets this one right. This is an important question, okay? We have some answers here in the chat box. 5 seconds. All right. Very important, right? But I can see why some people pick the blue. The PANS, or the positive and negative syndrome scale, symptoms scale, right? For schizophrenia, it relates, right? But that is not what we're looking for. We're looking for TD, abnormal involuntary movement scale, AIMS. If you do not know what AIMS is, please write that down. That is important in practice and is very tested subject. Okay, search on YouTube. I have done an AIMS assessment on a patient, right? What to do, right? So it's a really good tool. Ask them to put their mouth out, tongue, and assess how it's tremoring or not, okay, for TD, right? Now, since we're talking about TD, what other non-antipsychotics, because everybody knows antipsychotics could cause TD, could cause tardive dyskinesia. Think of a Raglan. Please write that down. That is important. Okay? Raglan. All right, next one. Ooh, recovery model, it's always about the person's goals and preference. We do not care about the diagnosis. The goal is not to fix schizophrenia or fix bipolar. All what I want to know in the recovery model is what are your goals? What do you want to achieve in life? And how I can help you get there, right? So it's about goals and aspiration. And remember, recovery model is never a straight shot to the moon. It'll be bounce backs, right? Doing good, coming back, doing good, and coming back. Just like starting, right? Sometimes we're in a row, few days in a row, and then we get stuck. It's okay. Take a break and get going again. All right. That was an easy one. All right. So we're almost done. Again, recovery model, it's all about their goals and objectives in life. It's never about curing the condition, increasing the medication, reducing the side effects. That is the pretty much the medical model, right? The recovery model, hey, I get it that you have schizophrenia, but if you want to be a chef, let's work towards that, right? So I'm concerned how to provide social skills so that the person can thrive and be a chef, for example. So here, her goals, preference, and potential for non-pharmacological strategy. That is part of the recovery model. Client, patient center. Tricky question, right? Okay, not that tricky. I thought a lot of people would get the red one, right? Develop a tailored treatment plan, outline specific steps for job training. That was tricky. Okay, I get it. Because that's what she's looking for. But again, recovery model is tell me what are your strengths, goals, and preference, and how we can achieve that together. That is the recovery model in a nutshell. Next question. Okay. So John comes to you and he needs help, right? But you're not going to say, hey, John, let's increase your Prozac from 20 milligrams to 40 milligrams to decrease your stress. No, right? Even if there was an option, what do you do first? You assess. So the question, the only one that has assessment here is assess to identify factors causing John's stress, right? We can go back to the basic. When you are stuck, ask yourself, is that an assessment? Is that a collection of data first before I jump into providing a solution? And then by assessing, you could develop a personalized treatment plan for John. Okay, so what do you do first? You assess. I'm looking for other answers. Okay, green has assessment, including them in assessment, inform the family. Do we inform the patient's family? No, right? So we can take green out, conducting safety planning. Safety planning is high yield, never a safety contract. If you do not know what is the difference, please look it up. Safety planning is a go, safety contract is a no-go as an answer, okay? And explore what are the reasons that someone may be having suicidal ideations, right? what is the first thing you do? You assess. This is a repeat question. Just change it, few letters, numbers, age. It was even the same person, right? So, oh, the previous one was Mary. Oh, I'm not sure if the previous one. I thought it was Sarah too. But anyways, assess, perform a risk assessment to evaluate the severity of the self-harm ideation. Super strong answer, right? Okay. Okay. Sarah, I think it was Sarah again, right? She's been having problem, and while the medication helped, it didn't help with the panic attacks. What am I going to do? Am I going to implement something, a therapy, mindfulness based stress reduction, like my patient today? That's what I did, right? Or am I going to, hey, you need to see me every day, which is that guy that I saw, I have him come in every day, right? But not a good option. Increasing the dosage of her current medication regimen. You know, she's been taking, it's not helping. Recommending inpatient hospitalization for intensive treatment. No, right? So again, implementing mindful therapy base to reduce the stress, right? So the problem is the stress. Let's reduce the stress. Okay, so Amy, she is doing cognitive behavior therapy and medication. Well, helpful, not that helpful. What am I going to do? Explore mindfulness-based stress reduction as part of a treatment, or conduct a comprehensive assessment to identify the stressors. Why are you stressed? What are the triggers? Again, the yellow here, oh, pumpkin color, explore mindfulness-based stress reduction as part of the treatment is good, right? But I want to assess first. If there is an option to assess what are the stressors, that would be my first step. So conduct a comprehensive psychosocial assessment because it's the work that's stressing her out to identify the stressors and triggers. Okay, we got 5 seconds, so better pick your answer. Okay, Emily came over to my office and she's with severe anxiety and panic attacks. Am I going to implement the exposure therapy to desensitize Emily, the traumatic memories? Possibly, but what would I do before, right? Hey, Emily, you're safe here. I know we just met, but you told me about this traumatic event, right? So it's not that the A option here is wrong, but we don't do this when somebody's super stressed, right? We can do this tomorrow, maybe, but we don't have to do this today. The most important is safety at this point, right? I'll create a safety environment. Because if there is no trust, there is no therapy. You utilize the trauma-informed consent principle to create a safe and supportive therapy. So it's a mixture of A and C answer, right? Okay, so it's a borderline patient, right? What she needs DBT. Who created DBT? Marshall Ham. Why is important? To decrease crisis behaviors, right? In this point here for her is to teach emotional regulation and decrease of the stressful stress events, right? So being stress tolerant. DBT would be a great option for this person, right? All right, everyone's going super fast here. That's good. Okay. So before you prescribe metformin, right? What do you need? What do you need to do? Collaborate with a dietitian, and most important, lifestyle modification, right? So yes, you can initiate counseling cessation. I don't even remember if the question had anything to do with smoking cessation. Anybody remember? I don't remember that. Maybe it was, right? But I mean, I blanked out. I honestly blanked out. I'm not making fun of anybody. But I don't think there was any question, anything about smoking. I could be wrong. I didn't take a picture, right? Switching to a different antipsychotic, it's a good option. But before we switch, what do we need to do? Lifestyle modification. Very important. That trumps even teaching the patient that how important the medication is. Okay. And I don't think that question had smoking in it. So why are we going to teach the patient about smoking cessation? I could be wrong. I really could because I don't remember. Okay. Now, can you prescribe metformin? Maybe, maybe not. Ask yourself, did you cause the problem? Meaning, it was your medication. Then you can manage. However, let's give this to the FNP, the PA, to manage the diabetes, right? But can you do it? Yes, you have the skills and knowledge to do it. As long as you cause it, the problem, you can fix it. In real life, we never do anything alone. Alone, we are weak. We collaborate, get other people involved, get their expertise, and solve the problem. So we got gastric pain, Depakote, fever, elevated myeloid level. So what do we have here, folks? It's almost a repeat question. I did this on purpose to make sure that you guys will pay attention, okay? Yes, Stacy, you got it. Okay, I know at least one person chose the wrong answer, but she knew the answer, so that's good. All right, that was almost 100%, so that's good. Very happy. That was a good one. Okay, yeah. Anytime you hear Depakote, immediately you should think of pancreatitis and liver toxicity, and you need to know the symptoms of pancreatitis and liver toxicity, right? Here we have it. Severe abdominal pain, nausea, and vomiting means pancreatitis. So what does it mean? If you get a call and says, hey, Dr. Lopez, I'm using Depakote, you remember me? I'm like, yeah, sure, I do remember you. And then he goes, I got this severe abdominal pain and nausea and vomiting. I'll come back tomorrow. Do you have an opening for me? I say, no, immediately. You got to go to the ED. Okay? And you should order your LFTs, even though this is not liver toxicity. But again, I put this here on purpose. Always ask for a ammonia level. So Depakote, pancreatitis, hepatotoxicity. Remember the LFTs, right? Let's collect the labs for the liver, but we want to get a ammonia level. Okay. Okay, last question of the night. Is the repeat question again, okay? This is on purpose. What are our concerns for carbamazepine? What are the 3 A's for carbamazepine? Okay, so very good, everyone. So you know, carbamazepine, you think of aplastic anemia, a granulocytosis, and Asian population due to Steven-Johnson syndrome, right? Now, finally, you get something for the CBC. Why do we care about CBC, right? Because we have to look at the whole white blood count here, or the ANC, right? So someone expressing fatigue, pallor, petechiae is indicative of potential hematological involvement, right? So stopping the medication immediately is the correct answer. Or the CBC will provide valuable information on the blood cells levels, right? So good job. So let's see the podium. All right. Maria H. Sarah. And drums. Danny. All right. So Bama and a funky. Okay. You know, these 5 really stood out for today's. But all of you guys are here and you learned something today. Okay? If you're not in the podium today, it's just a matter of time because you belong here. But we have to do the hard work. We have to study. We have to be upset, but we have to get up and do it anyways. Don't want to study? Do it anyways, because your best future will thank you later. Okay, you've done all this hard work, nursing school, your master's degree, your doctor's degree, and the test is the only thing stopping you from achieving greatness and moving on with your life. Go get the test, destroy it, destroy the test. Be angry about it. It's the only thing stopping you from your greatest potential. Okay, so what we'll do now, answer any question that's in your mind about the course, question bank, whatever. Class is over. If you've been with me for a long time, have a great night. Now it's all about questions for the students, right? So now whatever is in your mind, we'll stay back and answer your question. For you guys that are leaving, good to see you. Let me stop this recording. We'll post it on YouTube, and I'll see you next Tuesday night, 7 p.m. Remember, there will be 107 questions from my domain 1, 2, and 3. We completed domain 1 and 2. Now, the next foundation is domain 3. That is where we need to put our effort. 107 questions. That means if you really, really mastered, you pretty much already passed the board. Okay? So let's take a break.